For centuries, sailors crossed oceans, and many never returned, not because of storms, not because of pirates, but because of a mysterious disease called scurvy. A simple vitamin would eventually solve it, and one powerful advocate helped make that discovery and its impact possible. Her name was Mary Lasker. Before we talk about Mary Lasker, let's understand the problem. Scurvy caused weakness, bleeding gums, and death. It devastated sailors during long sea voyages. In the 18th century, British physician James Lind showed that citrus fruits could prevent scurvy, but scientists didn't yet know why. It wasn't until the early 20th century that researchers identified the essential nutrient responsible, vitamin C. One of the key scientists who isolated it was Albert Szent-Györgyi, who later won a Nobel Prize. But discovery alone isn't enough. Science needs support. And that's where Mary Lasker enters the story. Mary Lasker was born in 1900 in the United States. She wasn't a laboratory scientist. She wasn't mixing chemicals or peering into microscopes. She was something equally powerful, a champion of medical research. After losing loved ones to disease, she became determined to improve public health. She believed scientific research could prevent suffering, but only if it was funded, supported, and promoted. Mary Lasker and her husband created foundations that funded major medical research projects. She pushed the U.S. government to increase funding for health studies, including nutrition research. Thanks to advocacy like hers, vitamin research expanded dramatically. Public awareness grew. Governments began understanding that nutrition was not optional, it was essential. Vitamin C became widely available. Food fortification improved. Dietary guidelines evolved. The result? Scurvy became rare in developed nations. Millions of lives improved because nutrition science received attention and funding. Mary Lasker didn't just donate money. She influenced national health policy. She helped expand the National Institutes of Health budget dramatically. She believed that preventing disease was smarter than only treating it. Her efforts strengthened research into vitamins, cancer, heart disease, public health programs. She understood something powerful. Discoveries need voices. Scientists in labs need supporters outside of them. In the mid-20th century, few women held influence in science policy. But Mary Lasker became one of the most powerful advocates in American healthcare. She met with presidents. She advised lawmakers. She promoted scientific breakthroughs in newspapers and campaigns. She proved that leadership in science isn't limited to laboratories. It can happen in offices, foundations, and public forums. Because of nutrition research expansion, societies began understanding the importance of vitamins, the role of balanced diets, the prevention of deficiency diseases. Vitamin C is now common knowledge. But widespread understanding required education, funding, and advocacy. Mary Lasker helped bridge science and society. She made sure discoveries reached the public. Mary Lasker teaches us something often overlooked. Science needs champions as much as it needs geniuses. Researchers may discover life-saving nutrients, but advocates ensure those discoveries change the world. Support and curiosity together create impact, from sailors suffering at sea to modern populations enjoying better nutrition. Her influence helped shape healthier societies. Because sometimes saving lives doesn't require a microscope. It requires vision, courage, and the determination to support discovery.